The number of flu cases across the U.S. is increasing today, and the latest report from the CDC claims the virus is widespread in 43 states. There are 14,000 new cases a week, and at least 20 children have reportedly died from the virus this season alone. So CBS News contributor Dr. Tara Narula is with me now to talk about what this all means for your health. Those are some serious numbers.
They are, and it sounds really scary, and I think it really should get people's attention about this idea of being vaccinated. That's really the big message to me.
Right.
When people have talked to the CDC, the discussion has really been around the fact that this seems like it's a relatively average flu season so far. So although we're seeing this increase in deaths and increase in hospitalizations, we won't really know the full effect until the flu season is over, which runs anywhere between October and March, sometimes as late as May.
Okay.
Usually the peak is between December and March. So we may be seeing that peak in the next coming weeks. But in terms of the pediatric deaths, there have been about 20 so far at this point in the year, which is more than there were at the same time the previous year.
Right.
But when you look at the overall pediatric deaths, and it ranges usually anywhere between the 80s and mid 100s. So we're not sure where we will fall again. Is this going to be a worse year for children or not until the end of flu season?
Because we're sort of in the middle of the worst time for flu season.
We are.
So then I wonder, is it too late to get the vaccine if you haven't gotten it already?
It's not. And so that's the big message again, is to get vaccinated. That's really the best way to prevent getting the flu virus and to decrease the severity of the illness. People can still get vaccinated now, and they should get it sooner rather than later, because it takes about 2 weeks for the body's immune system to build up antibodies. And it's recommended for anyone over the age of 6 months, those who are particularly vulnerable, kids, the elderly, pregnant women, and those with chronic health conditions. And people don't think of the flu as being that dangerous, but it causes anywhere between 4,000 and 50,000 deaths a year, 200,000 hospitalizations a year. There can be complications from the flu, ear infections, sinus infections, pneumonia, meningitis, heart inflammation. So it's not without consequence.
I know. I think, people often think they have gotten the flu because they got sniffles or they were down for a few days, but I've never had it, and I know because people who have had it say, look, you're down for 2 weeks. Right. So then I guess suppose the follow-up question is that you always hear about the flu vaccine changes. Every year we get a different type of flu that comes around, and sometimes you'll hear, well, we predicted that it was going to be type flu A, and we ended up getting B, and so your vaccine isn't going to work. How's the vaccine this year?
Right. So we think that it's a pretty good match for the circulating viruses. The one that's the most dominant right now is the H3N2 strain, and that one actually tends to be more severe or serious for those at the extremes of ages, like children or the elderly. But again, they do pick the viruses they're going to put in the vaccine in the summer months. So a lot of it is playing, a guessing game. But it seems like they've gotten it relatively right this year. And usually the vaccines are about 40 to 60% effective. So it's not perfect, but
I'm just curious, if they pick during the summer months, what are some of the factors that they're looking at? I mean, are they looking at the other side of the globe to see what kind of flu is
they're looking
over there?
around the world, exactly, to help them make those predictions. Yes.
That's very interesting, Dr. Tara Narula. Thank you.
Thank you.